afternoon, everyone, and welcome to today's Public Health Ontario Rounds presentation during Annual National Non-Smoking Week. Our presentation today is going to be on a comprehensive look at youth vaping in Ontario and Canada. My name is Selena Degano, and I'm Senior Program Specialist at Public Health Ontario, and I have the pleasure of moderating today's session today. We would like to first respectfully acknowledge that we are all participating in today's session on traditional lands of many Indigenous groups. For myself and the presenters, we are located on traditional land of Huron-Wendat, Seneca, Métis, and Haudenosaunee people. Toronto is in the dish with one spoon territory, an agreement that meant Indigenous peoples in the area would share food and resources sustainably from a dish with only one spoon. This territory falls within the Upper Canada Treaties, and as settlers, we're grateful for the opportunity to live and meet here, and we thank all the generations of people who have taken care of this land for thousands of years. Now we're just going to go through a few housekeeping items. We just wanted to let you know that the chat pod has been disabled to limit any distractions during this presentation. And if you have any questions throughout the session, please feel free to use the Q&A pod at the bottom if you have any questions, and we will be discussing and going over those questions following the presentation. If at any point during this session you experience any technical issues, please email capacitybuilding@oahpp.ca. And as moderator of this session, I would like to disclose that I have no conflicts of interest. So now it is my pleasure to introduce our speakers for today's presentation. We have Dr. Robert Schwartz, Dr. Michael Chaiton, and Dr. Shawn O'Connor. Dr. Robert Schwartz is Executive Director of the Ontario Tobacco Research Unit, Professor at the Institute of Health Policy, Management and Evaluation at Dalai Lama School of Public Health at the University of Toronto, and Senior Scientist, Center of Addiction, and Mental Health. Dr. Schwartz is Director of the U of T Collaborative Specialization in Public Health Policy. At OTRU, Dr. Schwartz directs research, evaluation, knowledge exchange, and capacity building programs. He is widely published about tobacco control, accountability, public health policy, policy change, program evaluation, and government third sector relations. Next, we have Michael Chaiton, is an independent scientist at CAMH, Director of Research at the Ontario Tobacco Research Unit, and Associate Professor at Dalai Lama School of Public Health, University of Toronto. Michael has a PhD in epidemiology from the University of Toronto and has been active in tobacco control since 2000, when he started working for Physicians for Smoke-Free Canada and the International Non-Governmental Coalition Against Tobacco. He is co-director of the Collaborative Specialization in Addiction Studies and is instructor of a graduate level course, Tobacco and Health from Cells to Society. His work includes understanding the impact of policy on smoking cessation and the development of tobacco-related comorbidities. Dr. Shawn O'Connor is a senior manager at the Ontario Tobacco Research Unit at Dalai Lama School of Public Health, University of Toronto. He is a recognized expert in the surveillance of tobacco, electronic cigarettes, and cannabis products and their population level outcomes. Shawn's current research interests are on vaping and cannabis, with emphasis on point of sale marketing and how cigarette and e-liquid packaging is used to promote industry products. So I would like to pass it on now to Robert to start the presentation.
Thanks very much, Selena. It's really a pleasure to be here today and to be able to present some of the work of the Ontario Tobacco Research Unit. Three of us are presenting today, but we are presenting the work of a big team, a big and strong team. I'm just going to do a very brief overview of the three sections that are going to be presented here today. And I want to start by saying that e-cigarettes, today we're focusing on youth vaping, but e-cigarettes, we all know, may be an opportunity as a harm reduction tool for people who smoke. That is a highly debated question that we're not going to address today. Today, we're focusing on the risks to youth who are non-smokers who start vaping. We're going to start by showing you a slide with the rates of vaping, and many of us are quite concerned that so many people who are young and would not have been smokers are using e-cigarettes. Then we're going to go on to a presentation by Shawn O'Connor, looking at how much these devices are being marketed to young people, especially, That'll be followed by Michael Chaiton speaking about the effects of e-cigarettes, dependence, respiratory problems, and more. And Michael's also going to talk about some potential solutions to help stop people from vaping, helping them to quit vaping. I'm going to follow Michael, and I'm going to talk about more solutions, but on the policy side. What policies do we have in place, and how effective are they? So with that, I'm very pleased to pass it over to Shawn to begin the substance of our presentation.
Great, thanks, Rob. All right, so we're just going to start off with a slide that is showing past 3-day vaping amongst 18 plus. This is from the ITC Policy Evaluation Project, their survey. So we can see here at the end in the box that there was a dip in 2020, and that may have been COVID related, and it could be because of COVID. It could be because of the sample trying to be obtained through COVID. We do see a little bit of a bounce thereafter. Canada is the red, and we can see that it's marginally higher than the other countries, England and US. Another survey, the Canadian Tobacco Nicotine Survey in 2021, it had 4% of 25 plus. So amongst the whole, amongst the adult population, vaping is quite low. When you break it down to young adults, 20 to 24, it jumps up to 17%. And then 15 to 19-year-olds is 13%. So we do see that vaping is as a youth and young adult problem in particular. All right, so my portion of the talk is going to be exposure to advertising and promotion. And the first study I'm going to be talking about is a policy review on social media. And the question that we're asking here is, does e-cigarette advertising on social media increase e-cigarette use among young people? So we're looking at policies around this. We're looking at 3 kinds of advertisements that are of interest. We're looking at paid advertisements. So for instance, a company, a brand may advertise a product somehow through social media, and influencer advertisements, and user-generated content. So how is social media being regulated in Canada? So the Tobacco and Vaping Act, it dictates that vaping products cannot be advertised in any way that are seen or heard by young people, including online. There's a Competition Act, and that indicates that advertisers can pay influencers to share content and promote products, but the influencers, they must disclose the relationship and base reviews and actual experience. There's a bill C-20, it's proposed, it's currently in the Senate. It does have some regulations which aren't passed yet about user-generated social media content. So it'll be interesting to see what happens with that regulation. It has been stalled, like I say, it's in the Senate now. And then a number of the social media sites have self-governing corporate regulations. So they've chosen to prohibit advertising. So we see here Facebook, Instagram, YouTube, Snapchat. Since 2019, Facebook and Instagram do not allow influencers to promote vaping products. And the question is, are there still influencers on there that are trying to get around the regulations? And as we know, people can be quite inventive of how they approach tasks like that. So, all right. So internationally, there's a number of jurisdictions that have passed various regulations. The British Advertising Standards Authority has banned British American Tobacco from using any social media sites to promote their products, and that's including the use of influencers. The Australian government has proposed legislation that would require youth under 16 to, I guess, get parental consent before they can use social media. And Quebec is really, in Canada, Quebec is really a highlight in terms of what they do. Quebec courts have upheld the regulation of e-cigarette advertising in line with tobacco. There's a ban on advertising to children, and there's a ban on online sale of e-cigarettes. So later on, we're going to be talking about a study we did with Youth Confederates, and we did it across the provinces. We weren't able to do it in Quebec because there was no online, we couldn't find online stores in Quebec that would sell this product. So that's encouraging. So the literature that we examined, it observed a number of interesting items. And so with respect to the tobacco vaping industry, greater enforcement of existing regulations was something that popped out in the literature and in the Gray reports. A ban on online sales. These are things that could be done. Ban on online sales, more stringent measures in the meantime, and then further legal challenges. For the social media industry, there was a number of policy options discussed. So restrict all e-cigarette imagery that appeals to youth, restrict hashtags. And I think that's you know a really interesting one, because some of the social platforms have a lot of hashtags, and people can search those hashtags to get to the content. So if words like vape, juul, and e-cigs and e-juice and all that were banned, it might have an impact. Moderate user-generated content, and whether or not Bill C-10 can do that, it'll be interesting to see when that's passed and interpreted. Increased enforcement of Facebook and Instagram voluntary policies. As I mentioned, they have policies about not showing content and about influencers. Make social media companies responsible for user-generated disinformation and hateful content. That seems like a broad stretch at first, but it has been done. There has been some I guess prohibitions on these sites with respect to trafficking, and you know it's been proven that it's been done for some topics. So it is possible that it can be done for vaping. All right, this next study is a follow-up, and it's similar, but it's we went around the world and got a number of experts. Now this is in process. We've got 3 experts. We're looking at several more, and the experts came up with a number of observations. Governments are slow to regulate and only partially regulate. Governments don't exercise the capacity to monitor and enforce. And we need you need a political champion, someone in government that is going to take this and run with it and draw attention to it. And the issue is complex. A number of the experts said that, and then some of them said its issue is made to be complex, with governments and social media companies going on that it's so complex we can't do anything. So one of the preliminary policy options: implement reporting requirements for social media companies, including listing e-cigarette advertisers, money generated, etc. Prohibit industry profiles, including manufacturers, brands, retailers, and take a global perspective on regulation. And this is one thing, it goes back to this issue as complex, or it's made to be complex. A lot of things are happening internationally. So if one company or one country, prohibits something, with social media, maybe it's happening in another country, and the audience is worldwide. So people can still see it, even if their own country, potentially, if their own country has regulations, it may be able to be filtered in from another country. So we did a youth social media study, and this was done where we set up fake accounts and jumped on to Instagram and TikTok, and we wanted to see what was presenting. We presented ourselves as a underage youth. We didn't really see any vaping related content on the site that came to us directly. Again, we weren't searching and looking for it. We just wanted to see what would come to us. So nothing really came to us. So we took a more active approach and tried to query about e-cigarettes, and we did find some stuff. So with respect to making searches, vaping, so forth, the content found, and it wasn't restricted, and it varied, from jokes, unboxing, and talking about addiction. We did that again. We didn't find any results. So there's some, interesting findings here. This is still preliminary, and we're continuing with this. We searched brands. We did find content. For Puff Bar, it didn't work, and TikTok stated may be associated with behavior or content that violates our guidelines. So this is interesting. So, this one time, this statement was there. It wasn't there for other times. So it's possible to put statements like this in, but it's not prevalent, or as prevalent as maybe the health would like to see, health community. There's very few brand profiles, very few popular e-cigarette users are hard to find, and there was no restrictions on following anything related to vaping. On Instagram, there was content is not suggested, only accounts were listed. And then when we searched brands, the major accounts can't be viewed, or they were restricted 21 plus, and so that's a positive. Other observations: smaller brands or vape shops can be followed, and you can look up a location of a vape shop in your area, and the platform will provide suggestions on content in the vape store's account. And it's relatively easy to find popular e-cigarette users on Instagram, and you can follow these users, and they unbox vapes and teach vape tricks and so forth. All right, so I'm just checking my time. I have a few minutes. Youth access to online sales of EGs. So again, let me see here. We have, can underage youth in Canada purchase e-juice from online retailers and have it delivered to them? So we had, we actually had a youth confederate that we jumped onto Zoom with, and we went to these internet stores and we tried to purchase content. And we went across the country. You can see here the various jurisdictions that we hit. So this is just getting into the site access. So 19 of the 20 stores had some sort of age restriction message. This is just like, how old are you type of thing, right? So 11 requested your birth date. So you enter your birth date, you can make it up if you want, and you get in the site. 6 had a visitor checkbox indicating legal age. Yes, I'm 18. You get into the site. One site had a message, must be 19. You get in the site. One site had a pop-up indicating it was a 19 plus site. You just shut the pop-up and keep on going in. And one site had no age check. So all these sites you could get into. All right, so this is where it comes to the purchase attempt. 2 of 20 retailers request age identification at time of purchase. So we ended the purchase attempt. So that's 2 of 20. So that's like 90%. Were 90% that sold us the products. So one of the 2 follow up the next day. They said, initially they said we're not. They initially said, we couldn't purchase through that retailer, but they followed up the next day saying, hey, there was a problem with your payment, and then they processed it over the phone. A third retailer who the sale went through on the first day followed up on the second day, said, oh, you got to send us ID, and that kind of stopped that sale. So here we go. That was the purchase, and here's the delivery. So we can see here, let's look at the second column, age check performed. So we see the very first 5 or 6 categories, Canada Post, there was no age check. We just left in our mailbox. There was the next 7 or 8 we could pick up at the post office, and age there was an ID check. You had to show your ID, and actually interestingly, it said 19 plus written on the package, where the very first 5 or 6 didn't have anything written on the package. And then we can see here a private courier, Purelator. There was no ID check performed. So it was really a mixed bag, not a lot of ID checks. And let's just go to an overall results. 95% sites had some sort of self-reported age check when you went on the site, but only 10% of sites ended up confirming legal age. 61% delivered the package. Delivering the package had some age verification notes on the mailing label, but among all the deliveries, age confirmed, 55.5% of the time. if it had age verification notes on the package, 91% asked for a signature. So that suggests that that's a good policy. As an aside, the 23 of the e-juice products we purchased all had flavor descriptors online that included references to prohibited flavors. So we were buying candy type flavors every time. And concluding notes, age appropriate ID before final sale, notification on package that age product is restricted. These are, something that should happen. Delivery agents, if picking up from a vape shop, you should demand age restricted message on the pack and asking for age proved ID. Public health, the message for them, education and enforcement. So with that, I think just to note other jurisdictions, my last slide here, there's an act in the US, Prevent All Cigarette Trafficking Act, and it creates a blacklist of non-compliant delivery sellers. Also, the US Postal Service has stopped shipping vaping products. And large companies like UPS, FedEx, and DHL, they no longer ship vaping products as well. And we're going to go to Michael Chaiton.
Thank you, Shawn. So my part of the talk is going to focus now on some of the health effects associated with vaping and the intention of many youth who are looking to quit and ways that we can that might be able to help them. OTRO has developed a vaping dependence cohort. We started recruiting for this in 2020, and we ended up with 3,300 participants at baseline, Canadians aged 16 to 25, who we recruited online. We used quota sampling so that we could get significant numbers of regular, ever, and never vapers, along with ever, never smokers, and both older and younger youth or young adults. This survey was conducted every 3 months for up to 18 months. We're actually sending this to 21 months. The final group who was recruited is now currently completing the 15-month follow-up, but some of the people have completed all 21 months of follow-up. The first health effect is around respiratory effects. So for this study, we separated those who were smoking from those who were never smokers, along with a group not shown here of those who were occasional smokers or had smoked previously. We've measured the number of the amount of e-cigarettes they had, the amount of e-cigarettes they'd used. So we looked at the number of puffs per session, number of sessions per day, number of days puffed in the past month, and as well for our first study, which is cross-sectional, we also looked at how many years they had also been they've been using e-cigarettes. We've now also looked at the longitudinal data, and results are sort of very consistent. But what you can see here is the red line represents is never smokers, and over increasing number of reported dose, essentially, of e-cigarettes over per month. And the blue line are those who were daily smokers, and that represents the number of puffs per month. And so at baseline, these are essentially never or non-e-cigarette users. So these are people who were not using e-cigarettes. And we see for that, unsurprisingly, never smokers report much fewer respiratory symptoms than daily smokers. So it's about 3 times less, even among this younger age group of 16 to 25-year-olds who are mostly healthy, and it doesn't include the folks who reported that they had asthma. So we can see that again, to the surprise of no one, that smoking is not good for your respiratory health. What we see as that the number of e-cigarettes increases, For never smokers, the rate of reported respiratory effects increases substantially. So those who are taking 800 estimated cigarette puffs per month, which is certainly a reasonable, regular level of e-cigarette use, they report symptoms consistent with that reported by non-e-cigarette daily smokers. So among youth who do not smoke and who have never smoked, their reported level of respiratory effects associated is consistent with the level of daily smoking in this age group. Now, remember, these are youth and they are relatively young and relatively healthy. And so this doesn't represent serious respiratory conditions or COPD, and even the level of daily smoking, the average number of cigarettes per day for daily smoker is also relatively low here. But we can see consistent respiratory effects being reported by never smokers with increasing levels of e-cigarette use. For daily smokers, what we see is that the increasing cigarette puffs per month is actually associated with a slight a decrease in the number of symptoms reported. So this suggests that, again, that cigarettes are probably very bad for you, and that whether or not the mechanism for this, I think, is unknown and too much to speculate, but that in some way that being able to reduce your cigarette content is probably of some benefits to those who continue to be daily smokers. The next health effect to look at is around depression and depressive symptoms. And this graph shows the vaping dependence score, which is a measure called the Penn State e-cigarette dependence index, and how that predicts depression scores at the subsequent wave. So we look at this, our full analysis of this looked at sort of controlling for that change, for the actual change in depression scores and symptoms. But this graph actually just shows you the association. And what we see here is that as the vaping dependence score increase, so those people with higher levels of dependence are associated with higher levels of depressive symptoms. And we see this cross-sectionally. We see increases over time among those who increase their level of dependence. Interestingly, we don't see it directly with simply measures of frequency. So number of puffs per day or sort of broader categorizations of use. Well, we see it that depressive symptoms are directly connected to dependence, to addiction. And that's consistent with some models also that look at smoking and depression as well. So this is a significant finding that e-cigarette use, and this is among never smokers again. So we are concerned primarily not with people who are trying to use e-cigarettes to help them quit, but the sort of the rates of use, the levels of use among people who are never smoking. And we see that one of the health effects that is associated with higher levels of addiction to e-cigarettes is higher levels of depressive symptoms. The primary purpose, however, of our cohort was to look at dependence itself and addiction. And we've done a couple of studies that are been published now, looking at sort of the measurement of e-cigarette dependence in youth, and we have a few that are emerging around other aspects associated with dependence and the development of dependence among youth and young adults. And I think the primary finding, however, is that among people who are regular users, levels of addiction and dependence are significant. That among current vapers, 65% of never smokers and 79% of ever smokers report being addicted. This reported measure is a self-perceived measure of addiction, but is consistent with the numbers we find when we have two other scales of dependence in this cohort, and both give similar numbers. The onset of dependence takes time, though, and this is what we have seen for the development of cigarette dependence, that for some cigarette measures of cigarette dependence emerge quite soon after onset, but others in full DSM criteria levels of dependence may take a few years. We looked at, in this cohort, we're examining the onset and how long reported onset for a number of different measures associated with addiction. And what we see here is that there is both a range, and that the time to the onset may take a significant amount of time. This is a preliminary study looking primarily at early data, and we'll be able to hopefully be able to differentiate some of the clumping that's seen here. But the early stage suggested that many of those measures start emerging around or emerge by 24 months after the first puff on an e-cigarette. We see clearly as well, and comfortingly, is that monthly vaping emerges before weekly vaping, which again emerges before daily vaping. But that process actually happens in relatively rapid fashion, with only about 6 months between becoming a monthly vapor to becoming a daily vapor. The symptoms of dependence that take longest to emerge are hard to resist vaping in places where it's forbidden, which was reported to take around 30 months on average, or waking at night to vape by around 6 months or sort of 5 years after reported onset of vaping. This timeline for vaping dependence is longer than what we've seen for cigarette dependence, that on average, most of these symptoms take or are presented by the proportion of the population by about 2 years for most symptoms. One of the things we looked at is who is the differences in that emergence by smoking status. And we saw some pretty substantial differences. And one thing that we saw is that smokers are much faster, much more likely to become regular vapors more quickly. That when we look at these frequency milestones, sort of how often you use vaping, from daily vaping, weekly vaping, and monthly vaping, that for daily vaping and weekly vaping, as smokers people who had been ever smokers reported a shorter time to meeting that milestone of dependence than those who are never smokers. So that suggests that smokers will become regular vapors faster. On the other hand, for all the other measures of dependence, we see the opposite, that those who are never smokers are actually more attain these milestones of dependence much more quickly than do smokers. So these other behavioral milestones, such as waking, smoking quickly after waking at night, strong cravings to vape, weekly strong urges, that never smokers are faster to attain these measures. And taken together, it suggests that one, smokers may be able to, their onset of e-cigarette use and their onset of regular e-cigarette use may be facilitated by their previous smoking. But never smokers who were not obviously addicted to another or to another form of nicotine weren't making a switch. And it's potentially that they were able to become addicted to e-cigarettes much more easily than those who were previously addicted in some way to another nicotine product. Now, clearly, youth who feel themselves to be addicted are also report intentions to want to try and quit. And we find that 31.8% of vapers reported an intention to quit vaping within 6 months. We conducted a machine learning analysis to look at some of these predictors of who is more likely to be intend to quit. And we see things like vaping frequency, did you vape in the last 30 days, older age of the individual, their perception of risk, both of cannabis, interestingly, and of vaping. And finally, and consistent again with what we know about cigarette smoking, finding vaping too expensive. We conducted a design charrette activity with a group of youth who to understand some of these processes of vaping cessation. And we, with this group, we co-designed a number of different interventions that might help youth quit vaping. This is an example from one of those sessions from an activity that we did called Postcards from the Future, where youth identified sort of some of the reasons they might want to look to quit vaping. A lot of ideas about regaining power, being free, breathing freely, and feeling good. We turned this activity into a direct intervention so that that the youth during the session were found this process of trying to understand what their goals were for both in their own lives and around vaping very useful. And we've turned this into an intervention called Not From 2050, which is essentially an opportunity to write for your future self, to write a message to you from the future, providing insight on and gratitude for some of the reasons you may, for having put in the effort to try and quit and to be successful. The second intervention that came directly out of these co-design sessions was an activity called Stop Vaping Challenge that we've now turned into an app that's available on the Apple App Store and on Google Play. And the idea of Stop Vaping Challenge is very simple. It's you can work with your friends to or by yourself to challenge yourself, just to not to try and quit, not to give yourself a sort of this is my final term to try at my only chance at quitting, but just to see what the experience of quitting is like and how easy it is for you and how long you're able to do it. To start it, you press the button, and to stop it, you press the button again, and it gives you some insight into how that experience went for you. And so we have really good feedback on this so far. It's been our preliminary analysis of it suggests that many youth found it helpful, including this review, that this is the thing that finally helped me quit. A focus group looking at this further found that 86% of users learned something helpful from this abstinence challenge. And that's our primary goal from this app, is to help people reflect on both, is e-cigarettes actually a problem for you? Do you feel yourself being burdened by that level of addiction? And most people then stated that even if they had relapse, they would try a new challenge again within the day. Our final intervention to come out of those sessions was an adaptation of a smoking cessation related intervention called Crush the Crave. We adapted Crush the Crave through those sessions. We specifically had people write up on diagrams of screenshots of the app, and then tested the efficacy of Crush the Crave for helping vaping cessation. We randomized 600 current vaping participants from our dependence cohort and assessed change in vaping behavior. We found that this was successful, that inviting people to use Crush the Crave, those people who were invited were more likely to be abstinent when we followed them up over time. With a difference in risks of between 22 and 16%, a total of 6% difference, suggesting you need to reach around 17 people to have one additional number of quit attempts. And this level of success is relatively high for these types of interventions. I'd also like to highlight the Lung Health Foundation's Quash, which is another excellent app that you could use as well. And with that, I'd like to turn it over to Rob.
Thanks, Michael. So we know that a lot of youth are vaping, some around 15% in the past 30 days, depending on which survey you look at. We know that there's quite a bit of marketing to these youth. We know that they can buy these things, even though they're not supposed to be able to buy them. And we know that vaping has some pretty serious effects on addiction, on perhaps an association, at least, with depression and respiratory symptoms. We know a lot more from the literature, but we're not going to get into that now. So what more can be done to either prevent youth from starting to vape or to help those who are vaping stop already? So I've listed 5 policies, some of which we have in place and some of which we don't. I've also noted that it's very challenging to know what the effect of these policies are. Because it's early times, policies take a long time to have an effect that is measurable. We've had COVID, which interferes with both the implementation and the ability to measure success. The market is constantly changing, and this is not a static issue. We have different products, different e-juices, different marketing, different places where you can buy them, and also differences across the country. And we don't have enough data. The data that we have from our representative surveys at the national level or at provincial levels is few and far between in terms of the variables about vaping. And there's a huge lag between the time that data is collected and we have any results whatsoever. So I'm going to go through each of these policies quickly, and then I'm going to show you the results of our discrete choice experiment that's related to these policies. So starting with age restrictions. In the, as we say, underage youth, about 14 or 15% report vaping the past 30 days. So the age restrictions don't seem to be working. 45% of them report that they are purchasing from retail stores. So there's a lack of enforcement on age restrictions in retail stores. And we've seen from what Shawn presented that online vendors will sell to underage people. Now, Ontario has restricted in brick and mortar stores the sale of flavored e-cigarettes and high nicotine concentration e-cigarettes to adult-only stores, usually vape shops. Has this had an effect? We don't know for sure. We have some emerging evidence from our cohort study. Maybe yes, but we need more data to be able to know that. So more needs to be done on age restrictions if this is going to be an effective policy measure. Well, what about marketing restrictions? Well, one of the big problems is that when e-cigarettes with nicotine were first legalized in Canada, they were legalized with a huge amount of marketing allowed. That meant that there was a very large uptake by youth. A lot of this marketing was youth-oriented, and we can talk about that another time. In 2020, new restrictions came in. So you don't see advertising now on billboards and in convenience stores at point of sale. There's a lot less marketing that you can do. But youth report in surveys that they continue to be exposed to a great deal of online marketing. And even the people on this webinar, a fair proportion report being exposed to online marketing. Next policy is about nicotine concentration restrictions. So it was thought that perhaps if we have a restriction on the nicotine concentration, that less people will use them, or maybe they'll become less addicted. Starting in 2018, there was virtually no restrictions, and in 2021, the federal government restricted the nicotine concentration to 20 milligrams per milliliter. However, studies demonstrate that just by restricting nicotine concentration, there is actually no significant effect on the amount of nicotine that people are ingesting into their respiratory system, because that has to do with other factors, including puff topography, including the power of the device that people are using, including other things that are in the liquids that are being aerosolized. So even though there's been a decrease in nicotine concentrations available, it's unlikely that this is going to have much impact on initiation by youth, on the development of dependence amongst them, or on the other side of helping or not helping smokers to use e-cigarettes for cessation. So this particular restriction or policy doesn't seem to be very promising. This next one, though, on restricting flavors, may hold a lot of promise. So in surveys and other studies, youth report that if they weren't for the flavors, they wouldn't be vaping. So we do have flavor bans in several jurisdictions in the United States, for example. And in Canada, you can see here that we have 4 provinces that have restricted the sale of flavored e-cigarette liquids, and 2, Ontario and British Columbia, that have restricted, that haven't totally banned flavors, but have restricted their sale to adult-only stores. What do we know about the effectiveness of flavor bans? Well, it's a systematic review or scoping review published in 2022 that said we don't have sufficient evidence to actually determine the effects of these bans. What studies are showing is that, and these are mostly American studies, that the majority of vapers either find ways to continue using banned flavors, or they switch to tobacco or menthol flavors that are still allowed. In some jurisdictions, it's only tobacco that's allowed. In others, it's tobacco and menthol or mint that are also allowed. Several studies suggest that a substantial proportion of young vapers would quit vaping, and that non-vapers would be less inclined to initiate vaping if we restricted flavors. But the jury is still out on this one. Taxation is a new measure. The federal government has started taxing as of October 2022 at the rate of $1 per 2 milliliters of e-liquids. And you can see here that some of the provinces have adopted their own taxation. We know nothing right now about the impact of this taxation on the actual initiation or continued use of e-cigarettes. As I mentioned, we conducted a discrete choice experiment that provides hypothetical options to young people to say what would happen if there were different possibilities of these policies that we've been talking about. So what we see is that what attracts youth to vaping are medium and high nicotine concentrations, flavors that include fruit and sweets alongside menthol, low price, and availability. So to sum up, we have a bunch of policy options on the table. They're not being effectively adopted or implemented until now, but there is perhaps some promise for the future if more of these policies are enacted and implemented and properly enforced. Thank you very much. We've got your emails here, our emails here if you'd like to contact us, and I'd like to pass it over to Selena.
Great, thanks so much, Rob. I'd like to thank Robert, Shawn, and Michael for an amazing presentation. I just also would like to note we will be going 5 minutes over the hour just to accommodate for the Q&A session. If you do have to attend another meeting, not a problem. It will be recorded and will be available for those that registered as well as online. So we're going to get started and go into some of the Q&A questions. If you have any questions as we're going through the Q&A, please feel free to pop them into the Q&A pod and we'll do our best to address as many as possible. So I'm going to start with the first one that came in, and I'm going to send this to Rob, but Michael and Shawn, feel free to jump in if you have any additions to it. So are these regulations against advertising vaping products or vaping behavior overall? So I think that was directed at the beginning of the presentation.
Yeah, I think that question, sorry, Selena, I think that question was about Shawn's presentation about marketing, and he was presenting regulations about the marketing of e-cigarettes, not about regulating e-cigarette sales or behaviors.
Mm-hmm. Yeah, and as Shawn had mentioned, it doesn't, at this point, at least on social media, they don't account for just visualization of vaping products. So from influencers and that sort of thing. All right, so moving on to the next question. We're looking at, I'm going to send it to Michael. Michael, did you notice any differences in terms of the dependency between males and females?
That I don't know off the top of my head. We did look at that. I'm sorry, I don't remember what the actual answer is for that. I don't believe that they were striking. I think the reason I don't remember it. No
problem. That's good. Okay, and then so also I'm going to throw you another question, Michael. There was a question around frequency of use. So the average number of puffs per session for someone who vapes, and is that dependent on how quickly they become dependent? Was there anything in terms of frequency or behavior of use?
Sorry, which question is this? What?
So is there an average number of puffs per session for someone who vapes? And then does it vary drastically based on the individual? And then how does that potentially compare to someone who smokes cigarettes?
I think our measurement of vaping is really hard. We're very used to measuring smoking, and smoking is a discrete activity. You know how many cigarettes you've smoked. You can count them in a pack. But puffing is not. So I think a reporting of puffing is I think all over the place, and some people do it in different ways. You know, that we see, you know, that we see usually a small number of puffs per session. A larger and then but that's pretty consistent, sort of between 2 and 5 per session, but the number of sessions per day is what really drives that overall frequency. And certainly people just use 1 puff per session or 1 or 2, but it varies quite drastically between individuals.
Okay, great. Thank you. Okay. So were there any questions specific to about using cannabis in vaping? So vaping cannabis, or did you look specifically at nicotine?
We looked specifically at nicotine. We did ask about vaping cannabis as well, and we sort of verified their devices using images. I think it's a asking just about vaping. People will say vaping will many people will actually default to thinking about cannabis vaping than nicotine vaping, so you do have to be specific. There is an association between cannabis vaping and e-cigarette vaping. We've seen from other studies that there's that those who vape cannabis are more likely to use e-cigarettes as well.
Great, thank you. So one of the questions that came in was around policy. So Rob, maybe you can field this question around with some of the things that we've seen in terms of increasing of taxation of cigarettes and how it has caused some people to turn to other sources like contraband cigarettes. Could that potentially occur with vaping? Is there anything that we have around that topic?
So we are just starting a study on illicit vaping products. This is something that is up and coming, is the illicit marking that seems to be emerging for e-cigarettes products related to taxation or perhaps to other measures. So it may be related to flavor restrictions, for example. It may be related to decreasing availability in convenience stores, for example. We don't know very much about this yet. I wouldn't, given what we know about taxation and cigarettes, I wouldn't draw a causal relationship between taxation and the development of an illicit market.
Okay, great. Also, to kind of build off, Rob, I'm going to throw you another question. So there's been a number of questions around whether we should be looking at, because vaping has been a huge problem in schools predominantly, and whether we should be looking towards possession policies and vape bans specifically on school property, so not allowing them to carry products, and whether there's any evidence to support that that would be effective policy.
So, I mean, again, we don't have any direct evidence about this with vaping. This is a question that's been raised in the past about cigarettes. Should we have a possession restriction or just a sales restriction? The general wisdom on that is that a possession restriction is putting the onus on the consumers who are presumably the victims of the supply being pushed at them by big tobacco or big vaping companies, and by stores who are willing to sell to them. And so, for that reason, we've been hesitant to support possession restrictions. Whether schools should not allow students to have the devices on them, that's interesting. Is that enforceable? I mean, these are tiny. So I think that would be a challenging one to enforce.
Great, thank you. I think we have time for one more question. Just looking through, there's quite a few. So apologies, we're not able to get to all the questions. It was a great presentation, very, very comprehensive. So there was a lot of information, and clearly everyone's very interested in the topic. So just looking at, so one of the questions was around the role of social factors in youth vaping, and whether, the fact that they have social supply and the ease of getting that, and whether, using friends to purchase for them or convenience stores, and what are some kind of opportunities that we can fill some of those gaps to limit entry into the social supply.
I can take a first crack at that.
Sure.
It's huge. So according to self-reports, 55% of youth are purchasing through social sources. Can we reduce that? Well, the way to reduce that is one way to reduce that is by increasing the minimum age for purchase. We know from the research on cigarettes that if you increase the minimum age, then that does actually decrease purchasing by underage youth from social sources, because their social sources can't buy them anymore if they're less than that. So, I would personally advocate for increasing the minimum wage, going to a smoke-free generation, as New Zealand has recently passed, both for tobacco and vaping. But don't do it for vaping without doing it for tobacco.
Okay, great. Thanks so much. So we're at 1:05. I apologize that we weren't able to get through all the questions, but I would just like to thank again our presenters, Dr. Robert Schwartz, Dr. Michael Chaiton, and Dr. Shawn O'Connor for presenting. I would like to thank those that were helping in the background to help coordinate this event today. And all of you that were able to attend and stick to the very end, thank you so much. You can expect a brief anonymous survey coming into your inbox, kind of outlining some questions about the session, what you liked, and this helps to provide some information to help us plan future sessions. So hopefully you'll be able to fill that out. And lastly, you can access PHO rounds presentations and view confirmed upcoming sessions at the PHO website. So head to education and events and click on presentation. So I hope you all have a great day and thank you again.